The CEO of a Windsor hospital is making his case for an exemption to Canada's quarantine rules. It's quite the story. All started with a patient in the ICU who desperately needed a medication. And that CEO went to extraordinary lengths to get it. John is here to pick up the story from there.
Well, Heather, as you well know, popping from Windsor to Detroit isn't usually a big deal. But of course, for the last 8 months or so, it's been a huge deal because that border has been officially closed to all but essential travel. So the CEO of the hospital, David Musyj, was in a situation where a pharmacist said, we need more than one dose, and there's only one dose of this medication, not revealing what it is for patient confidentiality, but still, only one dose in the province of Ontario. They did a little research and found that across the river in Ann Arbor, Michigan, actually, there were enough doses available. So, David Musyj, he is not a doctor, he's a lawyer by training, but he is also a dual citizen and thought, well, rather than potentially lose a pharmacist to the hospital at this time, he was willing to go across, make the calls, and maybe take the risk and pick up the medication. He did. He traveled across, and then came time to cross back into the border into Canada. He picks it up from there.
He said, you can do whatever you want with me, but this medication's got to get to the hospital. They indicated to me that they will allow the medication in, but when it comes to me, I'm going to be quarantined for 14 days. I said, fine. And they said, what you need to do, though, is technically you're under quarantine. So the best you can do is kind of drive slowly past the hospital. Don't go inside, of course. Call and have a staff member come down and get the medication from you from the car.
So after that rushing, because it was really only 2 hours to go from Windsor to Ann Arbor, pick it up and come back again, then imagine, if you will, a kind of slow motion drive-by drop-off in this mission of mercy. Again, Musyj picks it up.
Got on the phone, said to the ICU, good news, bad news. Good news is I got the medication, I'm on my way. Bad news is you got to meet me in the parking lot. I'm not allowed to go up. So staff came down, pretty much I drove up, came to the window, handed it to him, and then I went home and quarantined.
We don't know what the patient has to say about all this because of the confidentiality surrounding this still, though. We know that Musyj has been working from home, as many of us do these days, so he's going to continue working from home as CEO of the Windsor Regional Hospital, and he will serve out, though, the rest of his quarantine there, having accomplished a tremendous amount in terms of potentially saving this patient's life.
And pressing his case now. I understand, I mean, this is the first time they've ever faced a conundrum like this. What happens if it happens again?
Yeah, well, you do a story like this, you end up doing some research into the availability of drugs, and certainly this isn't the first time that this has happened in terms of medications, especially even worldwide. Musyj says that the COVID-19 pandemic has made the shortage of some drugs all the more acute. So just in case this is needed again, he has talked to the local Liberal MP, and that MP, we understand it, has passed along the concerns to the Health Minister, Patty Hajdu, because we have certainly seen the controversy in some cases created by those going back and forth across the border. What is essential, what isn't, who has permission, who doesn't, and this arguably a unique case, but still, when the pandemic, as it continues on, and as medications potentially come running short, what's the protocol? Well, they may be looking at it a little closer than they were perhaps a week ago. Heather?
Thank you, John.
Okay.